My name is Ashley McCants and I'm an occupational therapy student. This is another video for my channel, and this will go through sleep and routines for children. Let me try to figure this guy out. Hello, my name is Ashley McCants and I'm an occupational therapy student, and I'm making this YouTube channel with parenting tips and tricks and stuff that I've learned through my doctoral capstone experience project. And feel free to check out other videos and leave comments on this one if you have any questions or comments. So this video will be sleep and routines for children. So with this topic, we will learn about safe sleep, how much sleep your child needs at different ages, naps, and how routines can help build bedtimes, sleeps, things like that. So first off, safe sleep. The ABCs of safe sleep. Babies should always sleep alone. Babies should always sleep on their back, and the baby should always sleep in their crib. At times in the beginning, it might be easier to hold child while they're sleeping. Once they get used to being in the crib more, it will get easier. That's just more so for if you're really tired as a parent or a caregiver and you're holding them while they're sleeping, it's pretty easy to fall asleep. So try to always keep baby in the crib sleep. So safe sleep, more techniques, and this will help reduce the risk of sudden infant death syndrome, also known as SIDS. Always place baby on their back to sleep. Make sure you use a firm, flat sleep surface and use a sheet that fits snugly in the mattress. And it's a pretty good example on the left up here with this picture with this kiddo. You can see there's nothing else in the crib besides the child, a mattress, and a sheet, and the sheet fits very snugly and flat. You also don't want to place anything inside the crib with baby, especially toys, blankets, unfit sheets, bumpers. These can be hazards that could also cause suffocation. Make sure there are no cords, ties, ribbons, or things or hanging mobiles above the bed, anything that is within reach of the child, as those can be hazards as well. Once you notice your baby is rolling over or showing signs of rolling, like really swaying back and forth, putting their elbows down, or they're able to roll themselves over while playing, which is at about 2 months, stop swaddling by then, because then they can flip themselves over and sleep, just like this kiddo is, where he just has his pajamas on and he's sleeping pretty good. Also, make sure baby has their own space to sleep, as bed sharing can be unsafe. Examples of safe sleep. You can see baby in his own space up here on the left with the really tired mom, and then on the right as well. Baby's in a different kind of sleep slack, but they're not swaddled because that baby is over 2 months old. Bed sharing or co-sleeping. So here's more information. This is not recommended, but if you are going to do this, because this is different for different cultures, there are safe practices to it as well. So make sure baby is always sleeping on their back if you are going to co-sleep, just as they would when they'd sleep by themselves. Make sure there are no pillows, blankets, or soft materials in the bed or around the baby. Dress the baby in minimal clothing to avoid overheating, and that just goes in general with sleeping as well. Make sure there are no hazards, just like previously, no cords, ties, ribbons, anything near the baby. Stop swallowing at 2 months, and then you can still offer a pacifier, but don't force it. And you can see up here in the top left picture, you have parents in bed sleeping with baby, and there isn't a giant blanket or anything around the baby. It's just 2 pillows up by parent's head and far away from baby, and baby sleeping flat on their back. And he also has kind of one of those sleepers on where it goes over their legs. This is a safe sleep video that I will be linking below, so feel free to check that out. How much sleep does your child need? So this will be section 2. So how much sleep do newborns need? So about 0 to 3 months of age is considered the newborn range. Newborns have their days and nights confused, so they will not be able to sleep a majority at night like most normal older adults will be able to do. Newborns will get about 17 to 14 hours of sleep over a 24-hour window. Breastfed babies will wake every 2 to 3-ish hours to be fed, and bottle-fed babies will wake every 3 to 4 hours to be fed. For this last section here, during the first few weeks of life, if your baby is sleeping for longer periods of time, make sure they wake every 3 to 4 hours. Once they get about to 2 months to 3 months old, you can stop waking them for that. But sometimes baby will oversleep and forget. This is because their stomachs are very small, so it's important to make sure they're being fed. This is also another big reason why they will have their nights confused, because they're constantly sleeping and then waking. So sleep for 4 to 7 month old, most babies at this age will sleep about 12 to 16 hours a day. Most of this sleep will occur at night. Baby will still sleep about 3 to 4 hours during the day. They'll need about 2 naps lasting about 2 hours each. By about 6 months old, most babies will be sleeping through the night for 9 hours or longer with brief awakenings. Room sharing without bed sharing is still recommended until your baby's first birthday. Make sure you are no longer swaddling your baby for sleep, since they can roll over at this point. And bedtime and nap time routines can be very helpful at this time, since your baby is building their abilities to be sleeping more at night than during the day, but they will still need a nap during this time. Sleep for 7 to 12 months old. So sleep problems are common in the second half of baby's first year due to separation anxiety. So at this time, if you have, the kids will get more used to their stranger danger kind of thing during this stage. If you remember, or developmental stages, this is when stranger danger kind of happens. So separation anxiety will happen as well, because they'll realize you're not in the room with them anymore if they're sleeping on their own. So it might be difficult. That's why kind of room sharing is recommended till 12 months, but stopping at any point will still take some time for a baby to get used to. At this time, most babies at this age will sleep about 12 to 16 hours, with 9 to 12 of those hours occurring at night. Babies will still take about 2 naps per day, and every baby is different. They can have a nap that lasts just 30 minutes, and they can also have a nap that lasts 2 hours. But those naps should be pretty consistent with your child. Room sharing without bed sharing is still recommended until 1 year of life. Safe sleep ABCs should be followed until at least 12 months. And then this is a great time to stick to or start a bedtime routine. And we'll talk more about that later. So sleep for 1 to 12 years of age. This is how much they'll need and what naps will look like. So 1 to 2 years of age is 11 to 14 hours is recommended, with 1 to 2 naps during the day. And again, those naps can really vary and really depend on your child. Some will nap for 30 minutes and then some will nap for 2 hours, but it's between that 30 minutes and 2 hours. At about 3 to 5 years of age, 10 to 13 hours is recommended. Naps will begin to reduce during this time from 3 to 5 years old, and a majority of children will no longer nap by age 5. 6 to 12 years of age, 9 to 12 hours is recommended. Good sleep helps children by reducing stress, maintaining a healthy weight. It supports their heart health, and it actually will make learning easier because they can focus more during the day. So it's very important for children 6 to 12 years, and then even beyond that, 18 to adults as well. Make sure that you're getting the sleep that you need, because that can really take a toll on your body and then also your ability to perform during the day. Nap time for infants, toddlers, and preschoolers. So when do kids still need naps? Until 1 year of age, infants will need to take 1 to 4 naps per day. By about 18 to 24 months, children will only need 1 nap per day. And that again can range from that 30 minutes to 2 hours. I've seen kiddos that they'll only sleep for 30 minutes, and then kiddos that need to nap for 2 hours, or they're very, very grumpy. But naps should not be shortened if the child is not sleeping well at bedtime. So here are some signs that your child is not ready to stop napping. They become overtired or irritable when their nap time is shortened, and they have trouble staying awake during the day even after a full night's sleep. So even if they're sleeping that 9 to 12 hours at night, and that's a full night for them, if they are still having trouble staying awake during the day, then they will still need to take a nap during the day. So when should kids stop napping? Naps are an important source of sleep for infants and toddlers. There was an estimation, I think it was about a child will spend about 40% of their life in their first 5 years sleeping, which is very, very important. Every child is unique. Many will outgrow naps by ages 4 to 5. A child may be ready to stop naps if they're consistently resisting naps. They sleep through the night just fine, and they struggle to fall asleep at their current bedtime because they're currently taking naps. So if you're having trouble with kids staying up late, but if they sleep through the day, or they sleep through the night, they do really well. You can try reducing their nap time and seeing if that helps. Parents should slowly reduce the number and length of naps. So make sure you're not just cold turkey taking 2 hours away. You can reduce it to like an hour and a half, an hour, and see how your child reacts to it, because it may be different. It's going to be different for each child to find that sweet spot of, oh, it's 30 minutes and not 2 hours. You got to take your time to kind of come to that and see that. Also, with growing and changing, there will be occasional days where your child needs a nap, and that could be due to growth spurts. That could be from doing a lot during that day, especially during holidays or times where they stay up late or they're sick. They actually may need just to take a nap, even if they don't usually take naps. So how to transition away from taking naps. So transitioning away from taking naps may take time. It usually does take a decent amount of time, couple weeks. Rather than stopping naps altogether, replace nap time with a quiet time to sleep or play quietly. Many daycares and schools use this. I did one of my field works at a therapeutic day school where we worked with all kids with special needs during the day, and they saw OT, PT, speech, behavioral therapists, and they did this, and it's very helpful where they kind of just have quiet time. They can sit kind of by themselves, and if they need to take a nap, they can take a nap, because we have some kids that just need time to relax and just hang out for a little bit, and then we had kids that needed to nap for 2 hours, or they would be very, very grumpy. So during this time, for quiet time, you can actually offer activities that are quiet, like puzzles, reading, and coloring together, because those can be quiet. This can be a period of rest for your child. Even if they don't sleep, it's really good for them to have rest time throughout their day. Avoid replacing nap time with activities that make your child drowsy. So such as going for a drive or watching TV. These can make your child drowsy and then fall asleep and then end up taking a nap, even if they didn't want to or need one in the first place. So how sleep changes without naps. When children no longer take naps, they may need more sleep at night. So for example, preschool age children need 10 to 13 hours a week, or 10 to 13 hours of sleep a night. Sorry about that. Bedtime may need to be 6 p.m. or 6:30 p.m. so they can wake up by 7 a.m. So that'll give them about 12 hours. Bedtimes vary based on each child's needs. So this will get into bedtime routines and how tracking and having a routine can really help you with helping your child get a good night's rest and building good habits. So you can actually start this with infants. So bedtime routine for infants, we're looking at, they're very, very great for getting baby ready for bed. You can do soothing activities that lead up to night time that can help relax your baby, such as a warm bath, feeding, and then even reading and singing stories to your baby can help signal the end of the day and help your baby calm down. You'll want your baby to fall asleep on their own. This means doing the nighttime routine and then placing baby in crib while they're awake, while they're drowsy but still awake. So this will help them kind of get used to being in their crib to fall asleep rather than falling asleep on you and then just ending up in their crib. So it'll help with that transition. So example bedtime routines, and with all these sources that are in these PowerPoints, I will have a public link posted below this video of all of the PowerPoint and then the sources to help you out. So an example routine can look like: give your baby a bath if it is bath day, sit with baby in a dimly lit room and begin to relax, give your baby lots of cuddles, kisses, and talk quietly. You can try giving your baby a baby massage, and I'll have a link to that below as well. You can read a book quietly together, sing or play a lullaby to help your baby sleep, give goodnight kisses, and remember to put your baby in the crib before you fall asleep as well too, because it can make you tired. Bedtime routine for toddlers. So once your baby gets older, their nighttime routine will change. So once you get into that toddler age, toddlers love to be more independent. So it's important to include their wants and needs in the bedtime routine. You can try calming activities before bed, like coloring, drawing, puzzles, story time. Tell them about their or talk to them about their day or favorite things. Play with putty, have a snack. Starting a routine does take time. Stick to it and be open to changes too. So if your kid doesn't like something, like they don't like doing puzzles, but they prefer to color, don't make them do puzzles because you think it makes them tired. Allow them to have some choices with that. So an example bedtime routine can be giving your child a bath if it's bath day, go potty, get diaper ready, put on pajamas, brush hair, brush teeth, read a book together, snuggles, lullabies, give goodnight kisses, and lay down in bed. A bedtime chart is also a great visual tool that can help maintain a bedtime routine. It is normal for toddlers to push bedtime boundaries too. So if they're saying no, or they want to try something different, or they want to stay awake, that's pretty normal because they're exercising their own rights and their own kind of autonomy to saying, no, I want to do something different. So it is normal for that to happen. So make sure that you're sticking to their routine, and then also allowing them to make changes if they want. If there's something that you can change, doing brushing teeth first before doing hair, or reading a different book, or singing different lullabies, be sure to give them that choice because that'll make them feel like they're still in control, but you also can still get them to complete their routine. Example, morning routine. So even with just waking up, there is a good way to have a routine because it will help promote independence. And I'll also show you another chart too as well with that. So the steps for the morning routine could be waking up, going to the bathroom, changing diaper or pull up, get dressed, eat breakfast, put dishes away, brush teeth, brush hair, get bag ready for daycare or preschool, and dress for the weather. So these are the visuals that I was talking about before. So these are visuals for morning and night routine, and I'll have them linked below in a Canva, and you can actually print and cut them out and customize them however you want. So if you want to change things around, put things in different places, you can do that below as well. But these are kind of just put your kiddo's routine on them, and then when they complete them throughout the week, you can do stickers on them. I've seen that be really good motivators, completing stickers. Drawing on them, using paint on them, or if you do so many days good, then you get this candy, or you get a free choice or something like that. So those are always good in ways to incentivize and get your kids to do more. So ways to track routines, writing down, using the bedtime chart, using the visual charts. You can also use an app on your phone, and I'll give examples of that. So this chart is a great way to keep track of your baby. I created this on Canva, and we'll have the link below. It also has baby tips with it as well, so you can print it out or screenshot it and draw on it on your phone or on an iPad, or print it out however you choose. In the baby care journal, you can record naps, feedings, diapers, medications, tummy time activities, and then also baby's mood as well. These charts can be very helpful for understanding your baby, talking to your doctor about your baby, and then recording all their wake and sleep times. So at the top of the journal, you can actually see there's a wake up time and a bedtime as well. So you can look at that to see if baby's sleeping more at night, less at night, or having trouble. It's a great way to bring that to your doctor and ask those questions. So how to keep track with an app. So this is the app I've talked about before, the Huckleberry Care app. It does have paid features with like Sleep Sweet Spot and stuff, but I've really had it on my phone and used it before, and it's great. So you can actually for free record naps, feedings, diapers, medications, tummy time, and activities, baby's mood, milestones. In the app, you can easily add more than one child, and then you can also have multiple people on the app with you. So you can add a spouse or a caretaker that's over a lot that helps with baby, and they can record the sleep, the feeding, solids, things like that, and food. So it works really nicely if you have several children, so you can get an idea on Timmy's sleeping for 12 hours a night, and then Madison is 8 months old and she's up to 9 hours at night. And then you can see in the chart here, it'll actually show you the day for your baby, and it'll show you what eating, how long it took, and it has stuff for pumping as well, going to the bathroom, changing diapers, things like that. So it's great to have those. So thank you. Um, Feel free to reach out to my email if you have any questions, comments, or concerns. I will have a survey linked below too, that you can answer about these classes. If not, then you can just leave comments too as well. So thank you for listening in. Have a good one.